subscribe now and press the bell icon. Never miss an update.
Welcome to Health Live at Seniors Today. We are delighted to have here with us once again Dr. Kalpana Sarangi. She has been, as you would have seen on the montage earlier, she was our guest a few years back, and we've requested her to join us again. Before I request her to speak, I'm going to just introduce her. She is a senior consultant, one of the senior most dermatologists in the city of Mumbai, and she is at the Nanavati Max Super Speciality Hospital in Mumbai. She is a qualified MD in skin. She started as a dermatologist and subsequently established herself as the head of the Cosmetology Center at the Nanavati Hospital. She has over 3 decades of experience, and she is one of the few qualified skin specialists in the country, and to have established as herself as a cosmetic dermatologist. She has to her credit over 100 published articles in Indian and international journals, and also co-authored the textbook and atlas of Dermato-surgery and Cosmetology, Manual of Dermatology Surgery, etc. She is a recipient of 2 gold medals at the national level to her credit. And today we have requested her to speak about, we are in the month of December, and we thought it would be appropriate for her to speak about winter care and all that one needs to do in the winters. Over to you, Dr. Sarangi.
Hello, good evening, everybody. At the outset, I'd like to sincerely apologize for taking so much of time to come online. It's all technical glitch. And let us see. Last time I had done a presentation, and I think I got the feedback that they would like to have a one-to-one discussion. So I would speak a little bit now, and then we can have question-answer sessions. We'll spend more time on the question-answer session. So what is winter care? What happens in winter? All of us, irrespective from young to old or middle-aged, whatever, we experience certain type of changes in our skin. And what is that? First of all, there is a nip in the air. The air becomes dry. The moisture in the air becomes less. There is less humidity. So because of the environmental dryness, what happens is skin also loses a lot of water from the surface. So our skin, basically, which is the largest organ in the human body, it has 72% of water. And skin breathes, the body breathes through the skin, and we lose water through the skin. So in winter, what happens, because there is no moisture in the atmosphere, or there is no humidity in the environment, so we tend to lose more water. And secondly, why does it get more aggravated? Because in winter, we feel cold, there is no need of more, as the external environment is not hot, we don't have that urge to drink water. So our water intake or our fluid intake is much less. So what happens in the process? We drink less water and we lose more water. So in the process, what is happening is, and then because of there is a nip in the air, or there's the outside atmosphere a little cold, so the external vessels, which are called capillaries, the tiny, tiny vessels, they go into contraction. So what happens is that you tend to feel little dry on the skin. You tend to feel itchy because of the dryness. And if you don't take care of it, then it can lead to certain dermatitis. So first I will speak of general care of the skin in winter. Then we will talk about what are the problems which you can face in winter. So general care is you have to hydrate yourself internally. That is, you have to drink a lot of water, you have to take fluids, and you have to have lots of fruits and salads, which you don't feel like eating in winter. But why fruits and salads? Because they're natural. They contain natural antioxidants, which is required for the health of your skin. That is number one. Number two is you have to moisturize yourself. How do you moisturize yourself? There are 2 methods. One is before you take your bath, especially I'm talking for the senior citizens, because the sweat glands, the oil producing glands, they go atrophy, meaning with age, what happens? The number of glands which we have, which produces oil naturally, it decreases. So we produce less oil for naturally for our body. So what you do is you have to externally hydrated. So the best way to hydrate a skin of a senior citizen is apply some oil before your bath. Half an hour before your bath, you apply the oil. Let it get absorbed nicely into your skin and then take your shower. And after shower, what you do, before you wear your clothes, you apply a moisturizer, a thick moisturizer, which is, there are two types of moisturizer. One is a thin moisturizer, which is water in oil, and the other one, thicker one, is oil in water. So use the creamy type of moisturizer all over your body before you wear your clothes. This is number two. And the third thing, what you do is in prevention is before you go to bed, again, what you do with a wet towel, wipe yourself dry, especially your hands and feet and face, and then you apply moisturizer again. So this is the normal routine. This should be a routine for the daily skincare in winter. And the type of soap you should use is a glycerin-based soap or a moisture-based soap. Like you have a lot of soaps these days which are moisture-based or glycerin-based, so you can pick it up from the market. And some of them are also available in the pharmacy. You can pick it up from the pharmacy. Ask them for a moisture-based or moisturizing soap. They'll give it to you. Or you have a lot of body lotions which are moisturizing body baths. These days you have a type of body wash which contains oil in it. It is known as a shower oil. That is very good for the skin. You can use it for the skin, for your washing your face or taking bath. You can use that. So this is a general care. And besides that, drink a lot of water. Have a decent amount of oil in your oil, meaning fatty food. Like you can have avocado in the form of fruit. You can have avocado, which is very good natural source of fat for the body. And have a little bit of ghee. It's not bad for your health. These days, it is prescribed that we can have ghee without harming your cardiovascular system. You can have that. And whatever, sesame is very good. It has very good in iron, calcium, and also good in good fat and walnut. All these things you can have in your diet for a good skin, for good skin health. This is a prevention. And if you have, what are the skin conditions which you might have in winter? The most important thing is dryness of the skin, which is known as acquired ectasis or xerosis. Because of the dryness, lack of moisture in the skin, what happens there is the skin becomes itchy and dry. And then what you scratch, and when you scratch, it can get secondary infected. And when you have secondary infection, then it can lead to what is known as fungal infection. So sometimes in the groins, under the breast, in your armpits, or anywhere else in the body, you might land up with having fungal infection. So you have to take care of that. So for that, obviously, you have to come to a doctor. That is number one. Number two, most importantly, is you get cracks and fissures on the feet. Very many people, you see they'll get cracks on the feet, which is very annoying, and it is not only disturbing, but sometimes it can get painful also. So you have to take care of your feet. Care of the feet and hands is very important for our senior citizens. And every day before going to bed, one good advice I would like to give you is wash your feet and hand. And of course, you have to do for the face also. But feet and hand is something which we sometimes neglect. So you wash your hand and feet and apply good thick moisturizer before you go to bed. And if you have very deep cuts or very deep fissures in your feet and it's hurting you, so before you apply the moisturizing cream, you can apply some antibiotic ointment into the cracks and then use the moisturizing cream and wear a socks on top of it. So this is care of your hand and feet. And not only the skin, your hair also becomes dry in winter. Dry and frizzy it becomes in winter. And you have a tendency of getting dandruff. But what is dandruff? Dandruff is actually scaling from the scalp. Like how we scale from the skin, it is scale from the scalp also. So there are two types of dandruff. One is a dry dandruff, which you see it falls like powdery flakes on your shirt or on your body. It falls, that is known as dry dandruff. And there is a wet or waxy type of dandruff, which is sticky and it doesn't fall. It doesn't fall like a powder. So you have to take care of a dandruff because dandruff not only gives hair fall, but it also causes very bad itching and it causes discomfort. So how will you take care of your dandruff? If it is in a subclinical state, you can oil it and frequently wash your hair. Normally in winter, what happens, we feel cold and elderly people, they feel more cold. So they don't wash they wash their hair once in a week. That is not done. You have to wash your hair at least twice, or best if you have dandruff, wash it thrice in a week. So for that, what you have to do is you have to apply an oil overnight and next day morning, you wash it with an anti-dandruff shampoo. So if you do it thrice in a week, then you can get rid of your dandruff. So that is one. One is your dryness of the skin or xerosis. Two is your fungal infection for which you have to visit a doctor. Three is your dandruff. And four is if you don't take care of all these things, you might land up with secondary infection of your cracked feet, of your fungal infection. Even the scalp can also play up badly and you can get a secondary infection. So these are the common winter problems which you have on the skin. And now I'm open for questions. We can have a discussion.
Right. Thank you very much. I know, but it was short and fairly complete. I have a question. You mentioned about thin cream and thick cream. I have got a question. And normally we do not advise or request doctors for brand names, etc. But given the fact that there are so much available in the market and there's so many, medicines which and made by companies which are fairly reputed, would you recommend a thick cream that one should perhaps put?
See, the thick cream is like, the common differentiation is the thing which comes in a bottle. When it is moisturizing lotion, that is the thin cream. That is the water in oil in water. That means there is more of water and less of oil. So that is the moisturizing lotion. Any product where there is cream written, like, for example, I can give you a broad brand like a CeraVe or Cetaphil, where there's a cream written on it, it is more thicker.
Okay, yeah. So that's a question which I was asked, whether Cetaphil is a good moisturizing cream to get. And what about the normal cold creams that are there, which are available? Is that something that you would recommend?
See, there are cold creams which are available for years together. People have been using it. So there are two different things. One is the cosmetic and cosmeceuticals. Cosmetic is something which has lesser medicinal property. So they are mostly have emollients. So it will be sitting on the surface of your skin and it will not penetrate into your skin. But cosmeceuticals have additives in it and the active ingredients so that it penetrates into the skin and gives you long-lasting results. So as a doctor, I would advise you to use the cosmeceutical rather than a cosmetic.
Right. There is a few questions that have been come. One is from Shamla Ravi. What can be done for varicosity and discoloration of skin?
Varicose veins, like, if it is very bad, then you have to meet a surgeon. But if it is not so bad, then you have to do certain exercises, which is improving your calf muscles and then raising your legs when you're sleeping. You can put your legs on a pillow. And then what you do is when you're using a moisturizer, but when you're using soap during a bath, you can use the milking action. That is, you push the blood away from the feet towards your knees. That if you do daily on a daily basis, if you have very mild varicosity, it can be taken care of. And there are stockings also which help with varicose veins. But if it is more than that, then you have to meet a surgeon.
Right. A question from Mr. P. Satyanarayan. What could be the cause and remedies for continuous dampness on internal joints, irrespective of wiping intermittently during the winter?
Internal joints?
Internal joints, yes. Continuous dampness.
It could be some people, they sweat a lot from the folds. So you have to use a silicone-based powder. Like I can name it like a powder called Absorb powder. You can use it to prevent that stickiness and that sweatiness, and use pure cotton undergarments.
Right. We have a question from Sheila Kohli, who asks, what can we use for fungal infection at home?
See, people use vinegar water for fungal infection, but I wouldn't advise that. I think you should meet a dermatologist for your fungal infection. Only thing I can say is you can use a ketoconazole soap to prevent fungal infection. But if it is beyond that and it is bad, then you should meet a doctor.
Right. We have Dr. Saroj Basa, who's actually from, who's right now in Melbourne. We asked her to, fill in when you couldn't join. So she is joining us at somewhere late in the night from Melbourne. Her question is, should we use moisturizer with SF?
SPF. Yeah, it's advisable. It is always advisable to use either a moisturizer with SPF, or in these days, most of the sunscreen, they're very well advanced. In India, we have a lot of good products which is available. And it comes in a moisturizer. There are three categories, in fact, of sunscreens. One is the dry sunscreen, which is for oily skin. Then there is one which is for combination skin. And there is a creamy moisturizing sunscreen for mature skin. So if you have a mature skin or if you have a dry skin, you should use a creamy moisturizing sunscreen.
Right. A question on pigmentation on the face. I know it's not winter related, but or is it winter related? I'm not very sure.
No, winter related in the sense what happens, people because of it's cold, they don't use sunscreen, and then they prefer to go out in the sun. So the pigmentation increases. So you have to use a sunscreen. If you have pigmentation, the thumb rule is you have to use sunscreen every 4 hours. You cannot step out without a sunscreen. And we think that pigmentation increases the sun, like UV radiation, not only because of the sun. Your screen, your cooking gas, your telephone, your TV, all of them, they emit UV radiation, which can increase your pigmentation. Even the LED lights which are sitting under. So you should, whether at home or you're going out, if you have pigmentation issues, you should use a sunscreen.
Right. Is Rani Shekhar asks, is baby cream good for our skin?
Baby cream. See, baby cream, like people like to believe that baby cream is very safe and then it's good for the skin. It is good as an emollient, but it will not have any actives to work on a mature skin. So it will just act as nice protection and all that, but not like, you'll not get like some great results with it. But for a moisturizing, a feel-good factor, it's good.
Right. We have a question from Aruti Ghosh who asks, should steroid cream be used in fungal infection like eczema? And there's another question that has come in, is eczema fungal infection? This is from KV Lax. Recently saw a clip that instantly cures it by using camphor, milk, and a piece of banana. Mix well and apply in the impacted areas. In a couple of minutes, the skin peels off and it gets cleared.
See, steroid cream, like if it is given by the doctor, you can use, but use judiciously. In fact, we are running a campaign in India, no steroid in the creams. So steroid, what will happen is it will give you immediate result, but then there's always the flare back. When you stop the steroid, there will be a flare back and you should definitely not use steroid, self-medicate yourself with steroid. And secondly, about this camphor and banana, which you told, it sounds like a corrosive. So it's basically peeling the skin, meaning the skin is coming out. It is having a acid-like effect on the skin. So it is something which can be dangerous also. So you should avoid it. Like, some people use toothpaste on the pimples.
Right. There's a question which is, please suggest some collagen cream or lotion. Is that something that you would like to comment on?
See, I cannot take brand names on this forum, but yeah, there are a lot of cosmeceuticals, in fact, which has come with collagen cream. But you must see if the collagen is less than 5,000 Daltons, then it doesn't penetrate the skin. So it has to be a very good brand called collagen cream for you to take it.
Right.
So
this is a question from G. Vijayalakshmi. What is the best external application for eczema or a psoriatic patch?
Psoriatic patch. Okay, so best thing is you have to apply emollient, and then salicylic acid you can use. And if you're going to a doctor, under your doctor's prescription, you can use steroid for a short time. And there is some calciferol also is given for psoriatic patch, which is non-steroidal. And there's a new medicine which is in the market, which is very, very effective. It is known as tofacitinib. The ointment of tofacitinib is very, very effective.
Right. Doctor, this is a question that I got on SMS, which says, is it all right to do a teleconsult for skin, or is it always good to have go and meet a doctor physically, because I'm not in a big city?
You can do teleconsultation, but I sometimes, for 2 teleconsultation, I'd rather see the patient after the third time. It's for skin, it's always better to show the person in person. But if you can't, then we can do teleconsultation.
Right. And this is a question from Shada Parvare, who asks, in winter, skin gets dry and feels like scratching. After scratching, blood comes out. What should be done for that?
Like I told, first, before you take your bath, you use some oil, massage yourself nicely, wait for half an hour, then take your bath. Don't use too much of hot water, but that itself strips your body of the natural oil. And immediately after bath, use a nice thick moisturizer before you wear your clothes, and repeat that same thing in the night also. Night, if you don't want to take a bath, just wipe yourself with a wet towel or a hand cloth, and then apply the moisturizer again.
Right. This is another question, which is, I feel itchy in a particular portion of one leg. If I put aloe vera gel, is it okay? Or what else can I apply?
You can put aloe vera, it's suiting you. Otherwise, use the moisturizer.
Right. Doctor, there's another question which has come in. There are quite a few Ayurvedic uh, uh, ointments that are there in the market. Which one would you suggest for? Are these better than the ones which are available with chemicals?
See, I personally feel that, allopathic medicine is a known devil. So at least whatever is written, you know what is written. In Ayurvedic, you don't know what is written. Unless it's tried and tested, I suggest you don't go for it.
All right. And, this is a question which everybody asks. Which oil, coconut oil, olive oil, what should one apply for the hair, for the body, etc.? Which one, what would you suggest?
Unscented coconut oil is the best. And if you want, olive oil is a little thicker, but our Indian skin, we are very particular that we should not get tan, because when you use olive oil, the skin gets a little tanned. So if you're okay with it, then you can use olive oil. Otherwise, a good old coconut oil is very good. Cold pressed coconut oil is the best.
Cold pressed is what you would recommend?
Cold pressed. It's a natural form. It is not refined.
Right. Great, doctor. Thank you very much. You've, although you got a little late, but you answered, most of our questions. There are a few. What is safe to lighten the skin? This is not a winter question, but still, what is safe to lighten the skin?
Okay, see, don't go for steroids for lightening your skin, nor do you go for hydroquinone. Make sure that these two products are not there in your tube. There are a lot of other products available like vitamin C, arbutin, niacinamide, kojic acid, licoride. You check out tubes which has all these things and they're all plant extract. You can use it for your skin.
Sorry, I got the question wrong. What is safe to tighten the skin, not lighten?
Tighten the skin, safe to tighten. Retinol is good, collagen is good. Oral collagen, if you take that, also tightens the skin. And you can do certain treatments also for tightening of skin. Like, energy-based device like lasers, HIFU.
Great.
And you can do facial exercises also, which is very good. Facial yoga. If you go to YouTube and you check out some facial yoga, they are really good exercises, which really does tighten your skin.
Doctor, what if somebody has a kidney issue and is required to contain the liquid intake? What would you recommend for them in the case of?
We know they have to cut down on their liquid intake. So the only way they can hydrate the skin is by applying little, like wiping themselves with a wet towel or wet muslin cloth and applying moisturizer again and again. Because orally they can't take too much of fluid.
Right. There is a question which has come in. Please type the name of the cream suggested earlier, which is new in the market. Would you want to?
Tofacitinib is the brand. The composition I'm saying. Tofacitinib. Tofacitinib. Tofacitinib.
Great. Thank you very much, Doctor. What about the kind of pollution levels that exist? You are in a city like Mumbai, where even there the AQI levels have been going up considerably. Our friends in Delhi and various other places are facing a lot of problems with air quality. Plus, there is the winter. Is there any general overall view that you would like to give for skin care?
See, like I told you, environment is the biggest villain in the whole game. Environment meaning I'm talking of internal and external environment. Like, 5 things I always tell people. Hydrate yourself both internally, externally. Have a good balanced diet, holistic lifestyle. Do some form of exercise. Like when there's so much of pollution outside, you can do your yoga or pranayam at home. Breathing exercises are very good for the skin. And sleep well. 7 to 8 hours of sleep is very important. And take some supplements you can take an evening primrose oil, check your vitamin D3 and B12, and take a multivitamin which has zinc in it. So these all help in the skin health.
Great. Thank you very much, Dr. Kalpana Sarangi, for joining us today. The session was short, but very good. And, you answered almost all the questions that have been raised. Thank you once again. We would come to you again in a different season. And, thank you to the Nanavati Hospital also for facilitating this. And to all of you here, we will be back once again next Saturday at 5 p.m. for another session of Health Live at Seniors Today. Do remember that the new issue of Seniors Today magazine is available on the Seniors Today website. You've seen it's a Raj Kapoor special that we have, and there are a host of great articles that are there. There's an article by Mr. Harsh Goenka, which is also there. You must have a look at it and enjoy the rest of the week. And thank you once again to Dr. Sarangi. Thank you.
Thank you so much. And once again, sorry for joining in late.
No, not at all.
Thank
Thank you.
Thank you so much. Bye-bye.
Subscribe now and press the bell icon. Never miss an update.